Should we start?
We are started.
Oh, we have started.
Hi, folks. If you would do us a favor, if you can hear us, we would love to have one or several of you in your chat box. Let us know that you can hear us speaking.
Howard can hear us.
Thanks, Howard. I appreciate that. Thanks, Gina.
Great. Thank you. All right. Good afternoon. Welcome to our Partner Summit for the month of June. I can't believe it. So thank you, everybody, for joining us today. What we're going to do is we have a really good agenda going to share with you today, and I just want to let you know that it seems like it might not take the entire 90 minutes, so we might be able to give you some time back today. We have, just logistic-wise, we've muted everyone to avoid the feedback. So if you have any questions or comments, if you would type them into the question pane at any time during the presentation. We have members of our team. Members of our team will track the questions, and then we'll get you the answers. And then we'll also repeat those questions so that the wider group will know what the question was. So what we're doing is we're seeing that there are other people who are coming on, so we're going to give it a couple minutes for the rest of everybody to have the opportunity to join us. So I'm going to put you on mute for a few seconds. All right, we're back on. I guess I did forget to introduce myself. This is Thuy Hoa Le, and I'm the Chief Financial Officer for HealthierHere. I'll walk through and we have a guest speaker, which I'll introduce shortly. Today's meet and goals. Are we advancing the slide? Okay. So we have 3 goals today for our discussion. The first is that we're going to review the HealthierHere activities and updates. Secondly, we'll do, I'm going to provide a highlights overview of the partner payment triggers, where we're at in that process and your roles in that. The third item is we have a guest, Marguerite Rowe from Kankakee Public Health. Is going to give us an update on sharing our HIE, assessment findings. And that's basically our agenda for today. So before we dive into the details, the first topic of the agenda, we'd like to have a poll. If you could actually show the sectors that you represent, whether you're a behavioral health agency or community-based organization and social services, a community health center, hospital or health system, and other, we would really appreciate it if you can take a few minutes to do that. How many people do we have right now? 35. 35. It looks like we have about 35 folks today. There is a link that Melissa just sent out for the poll so that you can see it. If you have trouble seeing it, please identify on the chat and we'll resend it. It looks like we only have 4 responses so far. Okay. A couple of you are not seeing the link, so Melissa is sending it again. So maybe while folks are accessing the link and indicating which sectors you represent, I'm going to go ahead and provide a Healthier Here update. So one of the few things that we're doing in the last month is a lot of hiring. So I want to give you an update on who are in place at our organization. So we've hired Michael McKee, and he is our Director of Clinical Practice and Transformation. We also have Maria Gingri, who is our Director of Equity and Community Partnerships. In June, we added 3 project managers who's going to be helping us with our implementation plan and process and our project portfolio. The 3 new project managers are Mary Franson, Victoria Lowe, and Lisa Watanabe. And you will see their names on emails and invitations and communications from Healthier Here. So know that's our new employees. And then in July, we actually will have a new, in the finance group, we'll have a new fund flows analyst. And we are close on having a data analytics manager as well. So by the end of this year, we're projected to be about 14 employees, and then we'll go into sustainable maintenance mode at that point. In addition to that, we also have launched our website a couple of weeks ago, and it is HealthierHere.org. So if you have a chance, please go ahead and access our website and give us any feedback you might have. Lastly, we've also posted results from 2 of our recent surveys. So in today's meeting, we'll review the HIE/HIT results, and all of this information was in the June 18 Healthier Here Partner Digest that was sent out, I think, earlier this week. If you have not received the digest and you would like to receive the digest, go ahead and contact us and let us know. All right. So so going into our update from the finance area, we have the partner payment triggers. In just a little context, the governing board approved the methodology for allocation of our DY1 partner engagement and planning dollars on July 7th. So I'm busily putting together the payments and the contracts to address the payment triggers that you see on the list here. There are a couple of these that I want to draw your attention as your actions are needed. So I'm going to take one payment trigger at a time. The first is the completion of the current state assessment, HIE, HIT, and those have already been completed by partners, which was due on May 25th. The payment for that payment trigger or activity is not until August. I'm still working on the timeline, the exact dates, and that's why you see the asterisks behind those months in the provider payment timing column. The second payment trigger is based on Medicaid volume, and this has also been completed back in April, and the payment for that payment trigger is also in August. The next couple of payment triggers will require your action if you haven't done so. The first one is the partner participation and registration in the financial executive portal. You need to completely register by June 30th, which is next Friday, I believe. And then the payment for that would be in August. There are about 20 providers, according to a report that I just ran a few minutes before this call, that have not completely registered. In other words, these providers have received an email invitation from the Washington Financial Executor, but have not logged back in to complete the remaining steps. So I will be sending a reminder, but if you can look in your spam or junk email, because sometimes that email will land there, and check and see. And then additionally, if you are unsure if you've completed the registration steps, please feel free to contact me directly, and then I can help walk you through that. The second item, payment trigger that needs your attention, is the sign-in of the project-specific agreement, Addendum 1. I will be getting all the contracts ready for the PSA to be sent out either the end of next week or early part of July, so that and then those are due back to me signed by July 31st. And the payment for that payment trigger is going to be also in August. The last two payment triggers are the organization change plans. More to come on that. As far as we're still working on the change plan survey, so that will be sent out. We're aiming to send that out maybe early July. So the deliverable we're thinking right now is somewhere in August. We don't have an exact precise date yet, but that will be announced soon. And then the payment for that payment trigger will be in September. The last deliverable or payment trigger is the commitment to sign Addendum 2 for the implementation partners. That won't be until November of this year, and then the payment for that last payment trigger will be in December. Again, all of these payment triggers we captured in the project-specific agreement that would be sent out to partners, and then payments will only be made if the deliverable is completed on the due date that's indicated. I'm going to take a few seconds to pause and see if anyone have questions. So one of the questions is, will the two payments highlighted in yellow come through at the same time? Yes. So for those provider payment at this point in time, what I'm thinking is any payments that are due in the first wave, which is August, all of those payments will be bundled together, but then and be issued at the same time. And then the second payment will be for the September. Last payment is in December. I'm just giving folks like maybe a few more seconds in case they have any questions. Okay, the next question is, are there federal or state restrictions on how the funds from those payments can be used? The answer is no. All right. I think I have my email address for contact. So if you have additional questions after this call, please feel free to reach out and let me know. At this point, I'm going to go ahead and introduce our guest speaker today, Marguerite Rowe, who is the Chief Assessment Policy Development and Evaluation at King County Public Health. She's here to give us an update on the HIE assessment findings. And the relationship here is that King County Public Health has a contract with HealthierHere and supports our overall data analytics. And so we rely very much on Marguerite and her group to help us through this process. With that, I'm turning it over to Marguerite.
Hi, folks. So if we are, for those of you who are unfamiliar when we're saying HIE, HIE is Health Information Exchange, and HIT is Health Information Technology. So for those of you who have been tracking the work of the King County ACH, now known as HealthierHere, you'll know that the governing board has spent some significant time thinking about, at the end of the day, what are the core leave behinds? And these are the accomplishments that we would want to achieve. And I've highlighted the first one. And the first one is collaboration between the healthcare system and social services, evidenced by an interconnected HIE system, connecting providers from both systems and payment models that incorporate social service providers. And I would expand and say that social service providers also include community-based organizations. Next. So many of you have seen this vision before, and this is the vision that that Susan McLaughlin has talked a lot about around a person-centered approach to system transformation. So what we're talking about when we're thinking about the HIE and HIT system or systems is what we are thinking about is the information exchange and information technology that underlies these different systems in order for that connectivity to occur and for providers to have the information that they need. Next. Just a reminder again about our four projects and the focus populations: the bidirectional integration, the chronic disease, transitional care, and opioid use. Next. So for the HIE or HIT assessment, there have been a number of activities that have been going on. The central activity is the HIE Survey that all providers, and when I say providers, I mean Medicaid providers, were asked to submit. And these included, again, the behavioral health agencies, the health and hospital systems, and the FQHCs, the federally qualified health centers. So what we wanted to do is we wanted to gain an understanding of the various topics that you'll see listed on the slide. So about some information about the general organization, the use of electronic health records, how information is exchanged, telehealth and other mobile applications that might be pertinent to thinking about the projects that are selected, other technologies that are in play, and importantly, understanding where different provider agencies are related to population health management and registries. The survey was conducted in April of 2018. We asked both either the Chief Technology Officer or Chief Information Officer from each provider organization to respond. We also reached out to Chief Medical Officers to assure that we had both a provider and clinical perspective. You'll see that 12 of 14 hospitals responded, all 7 FQHCs responded here in King County, and 25 of 29 behavioral health agencies or networks responded. So moving on to the assessment and findings. So when we look across all of the information that we've been gathering, and particularly based on the survey, there are several key findings that come forward. One is that we have large variability in HIE, HIT capacity and use across and within sectors. Importantly, we note that there is a major gap in HIE and HIT systems and capacity among behavioral health providers. There appears to be a significant opportunity to help systems maximize and adopt the use of a population health approach. There are limited data partnerships and information systems that support clinical community linkages. I'm sure that that is not a surprise to many of you. And that we don't have a HIE or HIT system that supports the social determinant of health needs. So social determinants, by that we mean housing, employment, food insecurity, childcare, etc. And so we're going to spend the next few minutes going on in more detail. And again, please feel free at any point. I'm just going to keep moving forward, but feel free to chat or ask a question or insert a comment, and we'll take a pause at any time. So the first finding is really around the large variability that we're seeing in HIE and HIT capacity. Next. And we use this example of where we are on electronic health records simply to show the wide variability that currently exists, both, again, within sectors and across sectors. And so you'll see here that we have had, when asked which EHR systems do you use, these are the ones that were identified, and they're sort of all over the place. Next. Again, as I mentioned earlier, behavioral health providers have the greatest gap in terms of capacity, which also provides perhaps one of the largest opportunities for investment. So 75% of behavioral health agencies report using an electronic health record system. But very few, 16%, have population health management systems or tools. When we dive deep into population health management tools, we see that there's a low percentage of behavioral health agencies, about a quarter of them, have registries, and that, in fact, when asked why they aren't doing more, there are a number of barriers that were identified: training, cost, and standardization. Thinking about the opioid project in particular, more than half of the behavioral health agencies have no prescription monitoring program data, access to that data, and no current plans for its use. When asked how might HealthierHere help, there were a number of recommendations. One was enable a single shared care plan for a patient across all caregivers for that patient, financial assistance, training on use of registries to track patient panels, and supporting access to PMP data. Next. In addition to the large variation in infrastructure capacity and use, we saw that there was a lack of standardization in data collection, sharing, and use. And that's everything from the patient identifiers to other clinical information. So how might HealthierHere help? Recommendations were standardizing data and care management requirements across MCOs, managed care organizations, aligning data reporting and processes across Medicaid and Medicare, standardizing processes among healthcare organizations for the exchange of electronic records and other communications, such as referrals, and creating standards for data exchange between community and medical services. This slide shows the variation in terms of functions when we look at population health management. We asked folks to respond to what are the functions of your organization's population health management system. You'll again see that that variation and then lots of opportunity to help improve population health. Next. So what we took away from the questions around population health management, and specifically the use of registries, was that there are varying levels of understanding of the tools available and what best practices are in place. Most hospitals and some of the community health centers have population health management systems, and many fewer behavioral health agencies have those population health management systems in place. Hospitals and community health centers use those systems to identify gaps in care, but only about half of them use those systems to monitor and track patient and client engagement. And patient and client engagement could be everything from, in fact, following up on appointments, getting lab results back, or referrals to other agencies. A majority of respondents from hospitals and FQHCs have patient registries and do use those registries to improve the quality of patient care. A low percentage of behavioral health agencies have registries, and again, those barriers vary. Ones that we've heard before: the training, the cost, and standardization. As a reminder, population health management really is about collecting and analyzing data on segments of your patient population and managing specific disease conditions within that population. What it requires is an integrated infrastructure of people, process, and technology. So, how might HealthierHere help? Well, folks responded that it would be helpful to have an aligned registry for who is homeless or who is on Medicaid. Funding and technical assistance would be appreciated, as well as the sharing of best practices. So the second finding, again, is perhaps not a surprise, which is the limited data partnerships and information systems that support clinical community linkages. And as one example, we asked whether or not there are any community-based organizations or social service agencies who have access to your organization's electronic health records. And you'll see that the majority of those respondents answered no. Next. Of those who did share information with community services or social services, most exchanged health information via paper or fax with community-based providers or social service agencies. And again, how might HealthierHere help? We heard back that a real-time integrated referral flow that captures social service needs, or working with community providers for a better exchange of contact information, treatment capacity, and care plans for patients in common. So the third key finding in our HIE assessment was that, in fact, there are fragmented referral and coordination systems that address social determinant needs. So again, most of the majority of providers who responded do not share data through their electronic health records with community-based organizations or social service agencies. And in fact, when we looked in the early phase of the planning around the project plan for King County's ACH, in fact, what was identified across all 4 selected projects was the need for a single shared care plan for a patient across all caregivers for that patient. And again, financial assistance. So there's been a lot of work that's been done both with the governing board, the transformation committee, as well as the performance measurement and data group to talk about, in fact, what are, in fact, in the guiding principles that should guide the HIE-HIT investments. And these are 5 of the ones that have risen to the top. One is making sure that whatever investment we make meets the needs of users at the point of care. The second is to think about focusing on a handful of solutions that address King County's needs and project portfolio in as meaningful a way as possible. The third is to really leverage existing data infrastructure where it exists and roles where possible, and that is highly desired. And the 2 other ones are to prioritize areas of historical underinvestment, for example, behavioral health agencies and social service agencies. The last principle is one which has been discussed a lot amongst the various ACHs, and I know is a concern, particularly for those of you who have provider organizations that span multiple ACH regions, and that is around aligning with other ACH health information exchange, health information technology investments. And that includes making sure that we think about the investments that are made at this state as well. So we have 2 polls that we're asking you to participate in. The first poll is, what is the top HIE-HIT area that HealthierHere should invest in to best complement your organization's priorities? And by this, we would hope that you would think about what HIE-HIT investments are needed for you to be successful in participating with HealthierHere in terms of their portfolio and achieving the overall transformation that we seek here in King County. So there are 5 options for you to choose from. The first one being the strengthening behavioral health, HIE-HIT systems and capacity, helping provider organizations adopt and use tools that support population health management, development of a shared care platform and lookup tools that support clinical community linkages, information exchange system that supports referral and coordination of social services. Again, those services include things like housing, education, employment, basic necessities of life, and then the standardization of data collection, sharing and the use, sharing data should be data collection, data sharing, and use and reporting. So let's see where we are. We're seeing some respondents coming. So far, we have sharing behavioral health or strengthening behavioral health coming into the lead with the development of shared care platform and standardization of data collection also. We'll give a few more seconds for people to add their votes in. We have many of you on the phone, and so far about 15 votes. So I think these are all pretty close. In fact, they are very close. I think our three top priorities that again are around strengthening behavioral health systems and their capacity, the development of a shared care platform and lookup tool, and standardizing data collection, data sharing, and reporting. So we do have one more poll. So does the poll, let me just ask a quick question of staff, do the polls close or can folks keep voting if they haven't? If we move on to the next one, can folks continue? No. Next question. All right. So if you did not have a chance to enter your vote, if you want to go ahead and put your vote into a chat, we'll also count it. This is really important information that will help as HealthierHere is developing their HIE and HIT investment strategies. So the next is a question about what is your level of agreement or disagreement with in the investment guiding principles that were put forward. So again, the 5 different investment guiding principles about meeting the needs of users at the point of care, focusing on a handful of solutions, leveraging existing data infrastructure and roles, prioritizing areas of historical underinvestment, and aligning with other ACH, HIT, HIE investments. So we'd ask you where on that spectrum from strongly disagree to strongly agree do you fall? And what I would say is if there are other principles that you think are very important that are not captured here, we would love to also hear what those are and would appreciate any feedback through the chat function. We see some folks are having a problem with their security on their own IT systems that are not allowing them to answer in their polls. We apologize for that, but know that we appreciate your input. If you don't have an opportunity to provide input through the webinar, we'd ask that you just go ahead and drop us a note via email. So we see that, in fact, there isn't anyone who disagrees or strongly disagrees, which is great. In fact, most people strongly agree or agree, and we really appreciate that feedback. All right.
All right. We were aiming to give back some time. This is Twee again, and it looks like we will be able to give you back some time today. So let's move towards next steps and close. I just want to recap some of the highlights, especially as it relates to payments to providers. But before that, thank you, Marguerite, for walking us through the HIE, HIT assessment findings. Again, if you have any questions, feel free to reach out to us, and we will address those questions as they come in, even after this call. So overall, the reminders, please complete the registration in the Financial Executive Portal for your organization. Remember that this is a multi-step, so by you completing the King County survey as a beginning step, then the second step is to actually have to log onto the Financial Executive Portal in order to complete the registration steps there. At any time, if you have any questions, please feel free to reach out to me. My email is on the slide that we'll be sharing with you after this meeting. Secondly, sign in the project-specific agreement, Addendum 1. That is the contract between the partner and provider and HealthierHere. Right now, you will receive those contracts by the end of this month, June, and then it's due back to HealthierHere by July 31st. The upcoming last action item at this moment is the completion of the organizational change plans. We will be sending that out to you probably about mid-July, and then right now we're thinking about somewhere in August. We'll set the exact date in August and communicate that to you soon. But be looking out for that change organization plans. We also have another survey that we would like to have your feedback on, basically how these meetings, whether they're beneficial to you, and if you want to see any changes to make it more beneficial, useful to your time. We are listening and we'd like to hear back from you. Also want to let you know that the slide deck that we are using today will be sent to you after this meeting. And then a reminder on your calendar is the next Partner Summit, which is on a Thursday on July 19th from 2:30 to 4 o'clock. That is basically all the news and updates that we have for you today. And again, we really appreciate the time that you spent with us this afternoon and participating in our polls. That was very helpful information. Thank you very much.